Now we'll see the different factors that affects the diffusion of gases across the respiratory membrane. Okay, different factors that affects the movement of or exchange of oxygen and carbon dioxide through the respiratory membrane. Okay, first let me ask you, what is diffusion? Diffusion is the passive movement of any substances from higher concentration to lower concentration, right? Here we are dealing with the case of gas, okay, oxygen and carbon dioxide. So we'll have to use the term pressure. Okay, so the movement of this gas molecule from higher pressure to lower pressure. Okay, and that particular process, that type of diffusion is known as bulk flow. Okay, so which kind of diffusion you can see here? It is bulk flow, by which these molecules, these gas molecules transport from higher pressure to lower pressure. Okay, now we'll see there is one more term, that is diffusion coefficient. Okay, diffusion and diffusion coefficient denotes the same meaning only. Diffusion coefficient is calculated per minute. Okay, diffusion coefficient is the volume of gas that can be diffused in 1 minute. Okay, so now we are going to see the different factors that affects the diffusion or diffusion coefficient. Okay, first is the pressure gradient. Since we are dealing with gases, we'll have to take the pressure gradient, okay, not the concentration gradient. Okay, first let me tell you, if there is a gradient means change, okay, gradient means state of change, difference. Okay, so if there is a significant difference in the volume of gases in two medium, you can see the force of this diffusion will be maximum. Okay, suppose if there is same pressure of oxygen here and the same pressure of oxygen you can find here also. Okay, here there is 5 millimeters of mercury, and in the capillary also you can find 5 millimeters of mercury. That means this two medium, these two places, these two pressures are in equilibrium. There is no more transfer of gas molecules, right? Only when there is a pressure change, that is, one should be higher pressure and one should be lower pressure. Okay, only when there is a pressure change, this transfer of gas molecules will occur. Okay, if the degree of that difference is greater, the maximum will be the diffusion. Okay, so first factor which affects the diffusion is pressure gradient. If a pressure gradient is higher, that means if there is too much of gas molecules in one place and in one side of this membrane, and little of gas molecules in another side, what happens? The diffusion will be maximum. Okay, if these two pressures are in equilibrium state, there won't be any diffusion. Okay, so if the pressure gradient is higher, the diffusion coefficient also increase. If the pressure gradient is lower, the diffusion coefficient will also get decreased. Okay, and second in the end of this session, I'll discuss about the relation between the pressure gradient and exchange of these gases. Okay, the next factor is solubility of gas. Why the solubility a big deal here? We know that there is fluid inside, the fluid lining in the alveoli, right? So whatever air that is coming into the alveoli have to cross this fluid lining. Okay, the alveolar epithelium is producing fluid, okay, and it makes a fluid lining in the whole length of this alveolar membrane. So whatever gas is coming into the alveoli, it has to first dissolve in the liquid medium in the fluid lining, then it has to diffuse across this membrane, right? So a gas which is having higher solubility can have more diffusion. Okay, will be having a more diffusion power. Okay, So solubility of gas is very much important here. Since oxygen is having higher solubility, the molecules of oxygen can diffuse across this membrane with such easiness. Okay, so second factor is solubility of gas, and third one is surface area. Surface area of what? The respiratory membrane. Okay, the respiratory membrane, you know that it consists of the alveolar membrane and the pulmonary capillary. Okay, only when there is a maximum surface area, more number of gas molecules can diffuse into. Okay, so there comes the importance of surface area. So in some respiratory disorders like emphysema, you might have heard. The emphysema is a condition in which this alveoli will be in a shrunk state. Okay, and that condition is known as collapse. The alveoli, despite of appearing like this, it will be appearing like almost a shrunk structure. Okay, which cannot accommodate any more amount of gas molecules in it. Okay, so in such a shrunk position, the surface area will be maximum lower, so the adequate amount of oxygen molecules cannot diffuse through, so the respiration and the cellular metabolism will be more difficult. Okay, so the emphysema is a respiratory disorder in which the alveoli will not be in a formal state, okay, will not be in a normal state but in a shrunk state. What is the characteristic of this condition? It will be having minimum surface area. By means of this minimum surface area, only a little molecules, okay, little number of molecules can diffuse through, so the respiration won't be easy. Okay, so if the surface area increases, the diffusion of gases will be maximum, and if the surface area is decreased, the diffusion will be difficult or diffusion will be decreased. Okay, and next one is the molecular weight. Molecular weight of gas. Okay, so if the gas molecules is having more mass, the diffusion will be difficult. Okay, and if the mass of these gas molecules is less, the diffusion will be occurring with such easiness. Okay, so the molecular weight, the diffusion coefficient is inversely proportional to molecular weight. If it increases, diffusion decreases. If molecular weight decreases, the diffusion increases. Okay, and the next one is thickness of the membrane. What is the membrane here? It is the respiratory membrane, right? The respiratory membrane, which is composed of all the layers of alveoli and all the layers of the alveoli and the pulmonary capillary, right? So if this respiratory membrane is thick, okay, if any of these layers are thick, normally the respiratory membrane will also increase in thickness, right? If the thickness of the respiratory membrane is increased, will the diffusion be increased or decreased? It will be decreased, right? So the diffusion coefficient is inversely proportional to the thickness of membrane. Okay, if the membrane is too thick, it makes the diffusion difficult, and if the membrane is too thin, with such easiness the air will pass through. Okay, so these are the 5 factors which influence the diffusion of gas molecules across the respiratory membrane. Okay, now moving on to the relation between pressure gradient. Okay, now we are going to see in detail about the influence of pressure gradient and the movement of these gases. Okay, before that, let me give you a rough idea of the circulation of the body. Okay, we know that, suppose this is heart. Okay, this is 4 chambers of heart. This is the right auricle, left auricle, right ventricle and left ventricle. Okay, 4 chambers of heart. We know that the right side of the heart carries deoxygenated blood and the left side of the heart will carry the oxygenated blood. Okay, from where the right artery gets the deoxygenated blood? From the body parts, okay, from the systemic circulation. This is cells, okay. This is cells. So, the deoxygenated blood comes to the right artery, right ventricle from the systemic circulation. Then from the right ventricle, it directly goes to our lungs. Okay, this is deoxygenated blood. So deoxygenated blood, prior to going into the systemic circulation, it has to be oxygenated, right? The blood that has to go to the cell have to be oxygenated, and for that oxygenation process from the right ventricle, the blood will be moving on to the lungs through pulmonary artery. Okay, the only artery that carries deoxygenated blood is pulmonary artery. Okay, so by means of pulmonary artery, it goes to the lungs. From the lungs, all these processes will be taking place. Okay, from the alveoli, this exchange of gas is being taking place. And from the lungs, the oxygenated blood, now the blood is oxygenated, and the oxygenated blood will go to the right ventricle. Now you know how the left side of the heart carries the oxygenated blood, right? This is oxygenated, this is deoxygenated. So this oxygenated blood now comes to the left atrium and left ventricle. From the left ventricle through aorta, it goes to the systemic circulation. Okay, this is O2. This oxygenated blood comes to the left side, and this oxygenated blood itself, it is pumped from the left side of the heart and it goes straight to the systemic circulation, and it goes to all cells of the body. And from the cells, what is eliminated? Or carbon dioxide is eliminated, right? So this carbon dioxide rich blood is known as the deoxygenated blood. Okay, so this is carbon dioxide rich blood. This deoxygenated blood again comes to the right side of the heart. Okay, so you can find 2 kinds of circulation here. First, the circulation that brings the blood to the lungs, and from there it is taken into the heart. This circulation is known as the pulmonary circulation. Okay, the to and fro movement of blood with the lungs is known as pulmonary circulation, and the circulation which is going into whole of the body is known as the systemic circulation. Okay, it is this lecture is just to give you an idea of it. Okay, now we are going to see how the exchange of gases is related with the pressure. Okay, so now here we are using the term partial pressure, not just pressure. Okay, what is partial pressure? If we are taking a mixture of gas, the pressure of each gas is referred to as partial pressure. Okay, here in the case if we are taking blood, okay, blood is having 2 kinds of gases, which are the oxygen and carbon dioxide. Blood can be categorized into 2, deoxygenated and oxygenated. Okay, even if the blood is oxygenated, it can have some carbon dioxide in it. Okay, even blood is deoxygenated, even it is coming from the cells, it will be having some oxygen in it. Okay, so the blood, we can say it is having a mixture of these gases. Okay, so why we are using partial pressure? We have to denote the pressure of a particular gas from this mixture. Okay, that is why we are using partial pressure. So from here onwards, we are using the term partial pressure. Okay, So inside the lungs, what would be the partial pressure of oxygen? Inside the alveoli. Inside the alveoli, you can see both the oxygen and carbon dioxide, right? Oxygen that is going to the capillary, and carbon dioxide that is going to the alveoli. Okay, so the alveoli, in alveoli you can see mixture of both oxygen and carbon dioxide. Okay, from these mixture I am taking only oxygen now. So the partial pressure of oxygen. Okay, so what would be the partial pressure of oxygen inside the alveoli? Since during inspiration we are taking a lot of amount of oxygen into the lungs, right? During tidal volume we are taking 500 ml of oxygen, and this 500 ml, it is divided into different partition and it is going into each of the alveoli of the lungs. Okay, so to one alveoli, inside one alveoli you can see the partial pressure of oxygen is very much higher. Okay, so a value of the oxygen you can find approximately 104 mmHg, that is millimeters of mercury of oxygen you can find in alveoli. That means higher partial pressure of oxygen. Okay, that is oxygen is directly coming from respiratory tract after an inspiration, so the alveoli will be rich in oxygen. So wherever there is a gas molecule, it exerts a pressure. Wherever there is increased molecule of gas, the pressure also increases. So inside the alveoli there is more molecules of oxygen, so the pressure will be higher, 104.